Welcome. I'm Nikki Young, Program Manager with the Child Neurology Foundation. Today's talk is part of our ongoing series, bringing together healthcare providers and caregivers to provide expert advice to the child neurology community. Each topic focuses on what we heard from our partners and our families as a top priority. Today, we are discussing palliative care decisions for children with epilepsy. I am joined by Dr. Sarah Friebert, Director of Pediatric Palliative Care Services at Akron's Children's Hospital, and parent and author, Tiffani Goff, here to share their expertise for palliative care. Welcome, and thank you for joining me today.
Thank you so much for having us. It's a privilege to be with you today. My name is Sarah Friebert. I'm the Director of the Pediatric Palliative Care Program at Akron Children's Hospital in Akron, Ohio. And it's been my privilege to be captain of a very large and wonderful interdisciplinary pediatric palliative care team there for close to 20 years. Our work puts us in daily contact with many families, like you'll hear from today, of children with life-threatening, life-limiting, and even terminal conditions. And we have the opportunity to walk alongside them in their journeys from diagnosis to cure or to death and beyond, if that's what happens. We have a very large group of gifted professionals of all sorts of disciplines. And our job is to really try to make the journey easier, to reduce suffering that happens along the way, whether that suffering is physical, emotional, spiritual, psychosocial, whatever stripe it comes in. So you'll hear more from me today about how we can integrate pediatric palliative care into the journey of children with neurological conditions. And I'm privileged to be joined today by Tiffani Goff. Tiffani?
Well, thank you. Thank you for having me. I'm Tiffani Goff, mother of 3 daughters. My middle daughter, Tiara, was born with tuberous sclerosis, which is a rare genetic disorder. She had tumors in her brain, heart, kidneys, eventually her lungs, and had intractable epilepsy her entire life. She underwent brain surgery, VNS, numerous other procedures, and she passed away at 16 years old 6 years ago as a result of complications related to tuberous sclerosis. So today I'd like to talk about with Dr. Friebert how palliative care could have been a wonderful, helpful thing in our lives because we didn't have that. So Dr. Friebert, could you kind of explain what palliative care is?
Sure, and I am sorry that you didn't have the opportunity to engage with palliative care during your journey. I've had the privilege of reading your book, and I would recommend it to everyone who's listening today. Just the outline of the tremendous life that you lived and trying to make a difference and really get the care and help for your daughter, I think is a lesson for all of us, and everyone can learn from that. I believe that palliative care would have been really helpful for your family along the way. There is a lot of confusion about what palliative care is. A lot of people conflate it with hospice care and think it's the same thing. So what I think it's important to understand is that palliative care is a system of care. It's not a place, it's not one person, it's a whole system that's designed to be an extra layer of support for families who are experiencing any sort of serious health condition with a loved one. It's a team-based model in which we have doctors, nurses, social workers, dietitians, case managers, expressive therapists, a whole host of people who get to know a family, get to know your goals and your values and your hopes, and try to walk along and help you manage so that you don't have to spend 24 hours a day being your child's case manager. You can spend time with your other children. We try to provide support for concrete things, resources that you need help with, making sure that you're connected with things in your community to help your child stay at home, and also to support you when you're in the hospital in terms of making sure your child is comfortable at all times, and also ensuring that you have decision-making support along the way. A big part of our role is listening and helping families navigate the very complicated and fragmented healthcare system that we find ourselves in. And I know you had that experience, Tiffani. You were seeking care at multiple institutions. People don't always communicate as well as we should across those divides and transitions. And just trying to understand all of the options that were available to you, what the terms mean, what the pros and cons of everything is, and kind of how to shape those decisions in terms of your family's goals and values along the way. So that our goal is that no matter what happens with the child's life, that child gets to live as high quality a life as possible, and the family can end up feeling as good as possible about the decisions that you've made along the way. We know that we sometimes can't change the outcome, but we can ensure that there's as few woulda, coulda, shouldas for parents and families during and after a child's illness trajectory. Hospice care, in contrast, is care that's really focused on the last 6 months of life and really does have more of a terminal focus to it. There's a lot of overlap. There's a common phrase that all palliative care is not hospice, but all hospice is palliative care, meaning that once you're in hospice, everything that palliative care does applies to you as well. But we do a lot of palliative care for a lot of children and families who are not hospice ready or even hospice eligible yet. So it's a farther upstream model of care that really looks at months and years of working with families over time, and then incorporating a hospice philosophy and a hospice team when that becomes appropriate in a more time-limited fashion. Does that make sense?
Yeah, it does. A few things that struck me when you were speaking is, one, being the case manager. I was able to do that, but not all parents are able to stay home. Some people have to work. And so having a doctor who could help actually look at all the different pieces of what our child's going through and make recommendations would be wonderful and relieve a lot of stress. And also, what you were saying, what I used to struggle with is quality of care and determining what is important. So a lot of times a doctor who's focused on the heart, he wants all of these tests because that's what he thinks he needs. Whereas maybe all those tests aren't that important. And having my daughter suffer through all of these tests when her biggest issues are seizures, to have someone defend me and say, you know what, let's skip some of the cardio tests right now. Let's focus on what's most important, what's critical, would be very comforting, because as a parent, you have to make those decisions or just do everything the doctors say, and your child is suffering. So we want them to be able to do the least amount, but will keep them the safest and the healthiest. And so I feel that the palliative care team could really help broaden that idea and really help us see, yes, it's okay to say no to something, or this is, does that make sense?
It does. And it's a very good explanation of how we do try to help navigate through a sort of a maze at times. I think it feels like there are all these options and people are asking you to focus on one organ system or one problem, or they're presenting a whole bunch of different things and not necessarily recommendations about what would be best for your child. Sometimes it's helpful to have somebody sit with you and say, okay, what are your goals? And are the things that are being proposed going to help us get to those goals, or are they going to take us farther from what it is that you want and need? On the flip side of that, I would say too, though, one of the reasons that palliative care and hospice suffers from a bit of a reputation issue is that people believe that when you sign up for hospice or you sign on to a palliative care team, that means you're giving up certain things. And so what we want people to understand too is that our job as palliative care professionals is not to come in and say, you can't have this test or you shouldn't do this. We don't limit care. Our idea is really, let's make sure you understand the benefits and burdens of everything that's being offered, and whether those things are in alignment with how we're going to get your daughter, your family to where you want to get. If your desire is that, and many families feel this way, you want to leave no stone unturned, you want to see every specialist, you want to try every test, we are not going to be the people saying, no, you can't do that, and no, you can't have that when you're in palliative care. And I want to be very clear about that, because a lot of people are afraid that palliative care means abandoning or giving up hope or giving up the potential for cure-directed therapies for children who have those options. That's not what we're here to do. We are helping to turn off some of the noise that's around you, reminding you of what matters to you. If your goal is to reduce suffering, to try to keep your child at home as much as possible, and to not put her through things that are not going to change her ultimate outcome, we're going to pick and choose certain things that are going to get us to that point. So I think in your case, Tiffani, we would have listened to you and said, is investigating this particular thing at this particular time what she needs right now? Or can we focus on something right now and address that later if it's still an issue, or not address it at all because it's really not going to change things and it's just going to add suffering to her life?
Yeah, it's interesting because I had never heard the term palliative care. And then one of my friends whose son has a brain tumor, who's gone through more brain surgeries I could ever imagine, she said it to me. She goes, well, do you have palliative care for Tiara? I'm like, no, what's that? And I said, is it hospice? She's, no, it's not hospice. And so I feel like we don't know anything about palliative care, and it would have been so helpful. And I will say, in comparison to hospice, when I was asking, the last months of her life, I was researching hospice, and I said to a doctor, I said, well, if I put her on hospice and I change my mind, he said, it's okay. It's not, you can bring her back here. He said, hospice is so, he goes, you're going to bring her to the hospital every 5 days. You're going to be here. And he goes, and if you don't want that for her, he says, then you can try hospice. And I'm like, oh, it's not as scary as we think. We still always have the option to give our child every medical benefit. And if we decide, you know what, I'm scared and I don't want her to die at home, or I don't want her to have this treatment, we can go back to the hospital. It's just a support. And I think that we people need to understand that, because we're missing this whole piece of our care that our children need and families need.
I couldn't have said it better myself, Tiffani. There's nothing that's written in stone. When you sign up for these extra support layers, that's what you're getting, an extra layer of support. And nothing is binding. Nothing means that you can't or shouldn't do something. It just means that we really are trying to give you access to as much help as you need. We describe our program as a palette of care, which is obviously a play on words with palliative. And I can tell you a little bit of how we got there, but basically the idea is that there's a palette, it's an artist palette, and it's covered with various different colors, like as if you were a painter. And this is very corny, but just bear with me. If I show you that palette as a mom or a family, and I say, on this palette are a variety of different colors, and each color or each paint pot represents a specialty or a discipline that may or may not be helpful to your family. So maybe there's a case manager, a child life specialist, a volunteer that could come to your home, a chaplain that could come and provide spiritual support when you can't get out of the house, a bereavement coordinator to begin talking with you about the losses that you're experiencing, whether or not your child's actually going to die, an art therapist who might help your nonverbal child express herself in a different way, a doctor, a nurse, a school person, all of these different people. Here's your palette. You take a brush and you dip that brush into the colors that you want and need, and you paint a picture of quality of life for your family. And the colors that you choose and the picture that you paint is going to be different for your family than someone else who's going to pick different colors on this palette. But my job is to make sure all the colors are on the palette and available to you 24/7, 365, no matter what the prognosis is, and no matter what you're choosing in terms of curative or comfort-directed care. It shouldn't have to be an either or. You should be allowed to make that picture of quality of life regardless. And that's our goal.
I love that I'm so visual, and that is a wonderful representation. I think we should have an ad like that because I didn't know that. And I think most families, and as you know, with having a special needs daughter with a neurological issue, we are so just treading above water at all times. We're just trying to not drown, that we don't have time to look for any extra help or anything. But if somebody had that and brought it to us, it would just be like a life-saving thing. But it needs to be like you're saying, we need to have these teams in all the hospitals so that we don't have to go searching for them. It needs to be offered.
That's my vision, that someday every family who could benefit from palliative care would have access to a high quality team, whether you're in a hospital or in a community. Community-based palliative care is just as important as hospital-based palliative care. And I think what it's going to take is folks like you and people watching to realize that this is available and to ask for it. Yes, we are hoping that the neurology community will look at this as an added layer of support that can only help bring additional support to the families that you're serving. But I think if families start to demand this kind of care, it will exert a sea change, basically. And we're really trying to get this to be standard of care, because I've had many families like yourself who initially they hear about palliative care or hospice and they get the look, right? The look of, oh my gosh, are you trying to tell me something? And no, I don't want that. And I don't want more people coming in my house. And I don't want more complications in my life. And I don't want someone talking about dying. And I don't. And without exception, every family that we've been able to meet, explain what it is that we do and what we don't do, which is come in and medicate your child until she dies, or come in and tell you can't have whatever therapy. Every single one of those families comes back later and says, who wouldn't want this kind of care?
Right.
Why wouldn't you want this for your child or anyone in your family when you're struggling? So I think if we can help break down those barriers and those fears, like the ones you talked about, it would be a great service.
Oh, I do, definitely. And when you're talking, all I'm imagining is actually having a person I could call on the phone when I'm in a scary position would would just be incredible. I mean, just sometimes as parents, our child is in a suffering, having a status seizure, this is happening, and we don't know what to do. And if I had someone knowledgeable who knew my family and I could call, that alone would be such an amazing gift.
That's one of the things that our team offers. And actually, a couple of years ago, the National Consensus Project published a set of guidelines about what constitutes a high quality palliative care team, and 24/7, 365 access to a care team who knows about your child and about your family is one of those guidelines. And that's what we offer. We always tell families that we are available. We will, 3 o'clock in the morning, if you don't know who to call, you call us. And we may not be the people that fix the problem, but we can get you to the help you need. So if you
Yeah.
can't figure out, especially many families or many children have more than one issue, like you mentioned. You might be a cardiac issue or a gastrointestinal issue or a seizure issue, a neurologic issue. Sometimes you don't know who to call. Do I call the GI specialist? Do I call the cardiologist? Do I take her to the ER? Do I take her to my primary care doctor? Do I just wait? Starting with us as your kind of one-stop shop of help me think through this.
Yeah.
And working through that 24 hours a day is immensely relieving to families, just to know there's one point of contact, and we are not there to get in the way of your relationship with your neurologist or take over her care in any way. We always work to update everybody, to keep everybody in the loop. We try to do joint visits, in fact, with your specialists when we can, so we're all hearing the same thing and we can help you process that information later. But that's our job, to be at the other end of the phone. You don't know what to do, you don't know who to call, and you don't know where to turn. You turn to us.
Yeah, I love that. And on that point, I have two daughters. One was older than Tiara, one is younger, and both of them suffered in different ways growing up with Tiara. I mean, they're amazing, compassionate girls because of it, but it was hard. It was very hard. Now, would your team be able to assist them and support them in any way, or what would that look like?
That's a great question. Siblings are sometimes called the forgotten grievers, as are grandparents at times, because they are sort of pushed one layer out of the way. When you have a special needs child who consumes you 24/7, you do the best you can to manage and be present with your other children, but you can't cut yourself in 3 pieces and be there equally for everybody. And so inevitably somebody suffers despite your best effort. Our team takes that very seriously, and we have a number of people on our team who are available specifically for siblings, so that sometimes it's a matter of them having their own person that they know is their person. That person is not Tiara's person, that person's my person. And that could be a child life specialist, it could be an expressive therapist, and by that I mean an art therapist or a music therapist. We also have a narrative medicine coordinator on our team who helps siblings write about or otherwise express their journeys themselves. It could be a spiritual care person, a chaplain, or somebody else, but somebody to talk to who's not mom or dad, who's not your ill child's doctor or nurse, but your own person, has been immensely helpful. We also offer a number of activities and support network types of things for siblings before and after their sibling dies. And I think just bringing those kids together too, it can often be helpful. So getting kids together with other kids who have experienced similar journeys, for example, so they have someone to talk to who knows what it's like to be the person shunted aside who has to go stay at grandma's house because my sister's in the hospital again, or mom couldn't come to my play again tonight because Tiara had a seizure, or whatever it feels like to be left out. Does it solve every problem? No, but we also have psychology folks who can function, in a counseling role, or can get kids to the help they need much earlier than when they sort of seem like they're doing okay for a while, and then later kind of the wheels fall off the bus.
Yeah, and I think that extra support, and like my girls both they had sibling workshops through the Tuberous Sclerosis Alliance, and they both talked about participating, but then there was kind of nothing to push them to do it, to help them. So
Yeah.
I think having that support person who checks in with them and says, maybe that would be a good idea for you to go to the SIB shop, or I think just long-term that support, because my girls both did, after Tiara passed away, they both have gone through their own traumas, they have post-traumatic stress syndrome from our lives. I mean,
Sure.
we did our best, but it was traumatic. So, and these kids are really suffering. Everybody's suffering, and we all, need to find a way to get through it and take care of ourselves as best we can. So
And I'm so glad you're being open about that, Tiffani. I think it's really important to acknowledge that you can do everything right, and it's really a normal reaction to an abnormal situation to end up being traumatized by something like that. In fact, I think we should think of that as just being the expected norm.
Right.
How can you go through living with 16 years with a sister who is really, really sick all the time and not have some sequelae of that? So if we couldn't take any stigma off of that, any shame off of that, and say, look, we expect that this is going to happen. So how do we manage it in advance before it becomes entrenched, before it becomes a severe addiction, before it becomes a diagnosable psychiatric disorder? What are the ways that we can put extra layers of support in for siblings and parents too, by the way, who are not sleeping very well, probably not having time to see friends or do any other activities or even participate actively in a marriage? How do we build in those experiences so that everybody doesn't end up needing prolonged PTSD psychiatric care afterwards? That's normal to expect that you are going to have that level of need for coping strategies and support. And to say it isn't normal is just boxing you into something that's unfair.
I do. I really think that is so important. And this is a little off topic, but one of my fears was, because Tiara was so violent with me and was always beating me up, I feared my girls would be drawn to an abusive boyfriend or husband, because that was normal, because she would beat me up. I'm bleeding, and then I would say, and then she'd say sorry, and I'd hug her. So I tried to explain to them, she's my child. She can't help this. This is a neurological, so this isn't okay. You can never, yeah. So, but it was something I worried about. And so I just always tried to be open. This isn't okay, but this is what's happening, and we're going to do our best. And luckily, neither of them have gone in that route, but they have other issues that they've done. So, yes, we are all going to be traumatized. And so let's just bring it out there. It's hard.
And Tiffani, I think naming it and just talking about it is the very best strategy, as you have been doing. I would like to say that there are a lot of different paths that families facing severe neurologic illness in a child can take. Your family's journey, which you beautifully outlined in your book, is one path. Other people take different paths. There are families that would have made different choices earlier on about surgeries or no surgeries, and maybe pursuing comfort-directed therapy long before you did. There were families that perhaps would not have gotten to the point that you would have. There are families that would have decided that for their own family's health and welfare, they needed to place their child somewhere out of care when circumstances start happening like you were talking about, where people are at risk physically. And I want to just say that all of those things are right. There are no right or wrong ways to do this. And every family has to consider the entire family in those decisions. And I think that's one of the ways that palliative care can help. There's sometimes so much focus on the child, what's right for this child. And certainly we want to make every decision in that child's best interest. But the brothers and the sisters and the mothers and the fathers also get a say in that. And family-centered care means that it's just as valid and ethical and moral and right to consider everybody's health in every decision that you're making and the course that you're pursuing. So I just want to be clear with people that you took one path of keeping your daughter at home and putting up with a tremendous amount of physical and psychological trauma. Other people might make other choices, and all of those are perfectly fine.
One thing that I really struggled with was when Tiara would have different symptoms. Sometimes I didn't know, is this a GI issue? Is this a neurology issue? Is palliative care, would the team be able to help me kind of figure out sometimes when I didn't know what was going on?
Absolutely. That's part of the reason for having that 24-hour access. But we've been talking a lot about the psychosocial support that we provide, but our team is also expert in symptom management and being able to look at what medicines she's on and what symptoms she's having and help you think through which is the best approach is part of our job. So one way we might be helpful would be just to run through all of the different symptoms she's having, the medication she's on, the potential interactions that she's having, and come up with some strategies about what could be done at home, what other medications might be helpful, what other routes of giving them would be helpful. So for example, if she's having nausea and vomiting and you're having trouble getting her medications in, maybe talking about some other strategies like administering the medications rectally or through other modes. All of that is part of what we help problem solve. We also try to get things started early. So if your goal is to try to stay at home and not go to the ER every time she has a symptom, what are the things that we can order for you and get in place in the home so that you can troubleshoot and not have to run to the hospital with every little symptom that she's having. And that's definitely part of our team. And we do that in conjunction with her other specialists. So depending on the child and the relationship, I might actually prescribe and then talk with the neurologist or the GI specialist and say, hey, these were my thoughts. This is what I did for Tiara. Is that okay with you? Or if the person prefers to manage, I would actually call them at 3:00 in the morning myself and say, I got this call from Tiffani and she's concerned about Tiara. How can we manage her symptoms? These are my thoughts. So playing that quarterback role around symptom management is a big part of our jobs. We are pediatricians or family practitioners or physicians who have been trained to look at a variety of different medical conditions, be familiar with them, and be familiar with medications that work in a multitude of different circumstances. So while we may not be experts in your child's seizure medications, we can help balance the symptoms they're having, the goals you have, and other strategies, even non-pharmacologic strategies, things that you might try, other medication therapies, things like that, that we can add to that palette, that menu, to keep your child comfortable so that you're not struggling. That's definitely a part of what we do.
Yeah, that would be incredible because each time we bring our child to the ER, then they pick up germs and get another condition that makes the seizures worse. So avoiding the hospitals would be so helpful for our children.
And that's really, actually, we've seen a lot of that this past year for obvious reasons, families wanting to stay hunkered down at home and keep their kids safe. We always walk a fine line. If your goal is that if your child got seriously ill, you would want major resuscitation and major things done, we don't want to do anything at home to mask what could be a serious health condition that would be more difficult to get out of later. But we also are very amenable to trying to keep you at home, prescribing things over the phone, even without seeing your child, or doing a quick telehealth visit. And we're generally much more available than some of the subspecialists in terms of getting you squeezed in for a quick, hey, how's it going? To get those things started at home so you don't have to expose your child to the outside universe and the risk. So I wish that your neurologist had suggested earlier on that you might have benefited from palliative care. And I think that if I can get a message out and can ask those of you who are working with neurologic professionals or those of you who are neurology professionals to really think about this being something that you offer to families. And if you don't have it available where you are, to start asking why don't you, and finding out what the resources are in your community to start building for that. Because I think that until every child has access to this kind of care, we're going to have more suffering in this community than we need to have. There's a lot of progress we've made in taking care of kids with neurologic illness. We still have a lot of kids who have a lot of conditions that can't be treated or cured, are on multiple medications, are undergoing multiple surgeries and procedures. And in the meantime, we need to, I think, acknowledge that there's a better job that we can do taking care of everybody's mind, body, and spirit through the journey. And I'm hoping that if people can become unafraid to ask for something, to ask for extra help, to say what else can be done for me and my child, not just what other tests or surgery, but how can you help me care for all of us? That hopefully palliative care, the palette of care, will be part of your family's journey.
I love that. I agree 1,000%, Dr. Friebert. I know our lives would have been much better. It would have helped a lot to have had that kind of care.
Well, your family did an amazing job in a very difficult and prolonged situation, and I had nothing but admiration for you with every page turn of your book. And I know there are thousands of stories out there like yours, Tiffani, and I just hope that we can bring a little bit of hope and maybe another path for some folks that were suffering silently or suffering alongside of you.
That'd be wonderful.
Thank you all for joining us today. We really are honored to have been able to talk, and I'm so honored to have been able to have this conversation with you, Tiffani, to learn a little bit more about you. And I can't say enough times that your book is an inspiration and a call to arms for all of us in healthcare to think about what we could be doing better for children with neurologic conditions and their families. Thank you so much.
Thank you. Thank you for everything you're doing, Dr. Friebert. Your work is really incredible and is helping so many people. And I'm really grateful that you're making this charge to let people know that we need palliative care for our children and our families. Thank you.
Thank you both so much for joining us today. We appreciate you sharing your expertise with the child neurology community. For more resources and some of the things we've mentioned throughout this video, make sure to visit CNF's website at childneurologyfoundation.org. Together, we are all child neurology.